Amy Pedersen is a former instructor at SDSU who has been living with lung cancer. She says it started with what felt like a cramp in her body before taking a trip to the hospital and getting a CAT scan.
The doctor that read your scan thinks you might have lung cancer. I said, lung cancer? I looked at my husband, I said, what the heck? Never smoked a day in my life, never worked around fertilizer or weed killers or anything like that. Where would it come from?
Dr. Chris Sumey is an oncologist for Sanford Health and says while lung cancer is most common in smokers, around 10% of non-smokers can still get lung cancer.
Lung cancer, unfortunately, is one of the cancers that can grow quite a bit before people would get any symptoms. So it's quite common that we find lung cancer before there are symptoms.
Pedersen soon started chemotherapy in the hopes of beating lung cancer quickly.
Those first few months were very frightening.
That was 12 years ago, and she's been living with it ever since. Pedersen started with chemo before switching to radiation therapy. While traveling down to Sioux Falls weekly, she was still teaching.
Lost my hair twice, bald head twice, and that was okay. I had a wig one time. I look back on those pictures of during that time, and I was like, oh, I had a wig then. I could tell the wig right away.
Pedersen says about 5 years after her diagnosis of non-small cell lung cancer, she found out that cancer was gene-related. She was given a new immunotherapy pill that targets the gene causing the cancer.
And by finding that gene, we can give a medicine like a pill, hopefully with few side effects, that specifically targets that gene and then turns that gene off. And so you can get remarkable anti-cancer effects without causing a lot of side effects to the healthy tissue.
Now, 12 years into her journey, Amy prays to hear the word stable as she continues to get scans every few months. She says she has always trusted her physicians and has always kept a positive attitude through it all.
Whenever I go in for my scans, I tell the technicians, think positive thoughts, please. I always ask them to do that. And I just stay positive about the whole thing because otherwise nothing good comes of that, being negative.